Oh my god, that's hilarious. Siri thinks I've said hey Siri and he's recording everything I'm saying. Hey guys, it's Charlie. Welcome back to my channel, or welcome to my channel if you're new. Today I'm going to be talking to you guys about some advanced courses that you can take from being a dental nurse. Now I do just need to make it clear that you can't become a dentist from being a dental nurse or a hygienist. You still have to go to university and do that qualification. But these are just different routes you can take. Can't really progress anywhere from being a dental nurse, but there are some things you can do to help you do something a little bit different. I thought I'd just share them with you guys today because I get a lot of comments asking me where you can go from being a dental nurse, what's the progression stage. So I just thought I'd share some stuff with you to maybe help you out a little bit. But please bear in mind that this isn't a progression stage. You can't really go anywhere. They're just different routes you can take down the dental path. Anyway, if you would like to hear about those, then just keep watching. Okay, so I'm going to talk about 4 main routes that you can take today. The first 2 are extra qualifications that you can have as a dental nurse, which you can apply to dental nurse practice. And the other 2 are different routes you can go down. So the first one is to do an impressions course. Now, as a dental nurse, we don't actually take any impressions. All we do is we mix the alginate, and if the dentist would like us to, we will load it in the tray. That is it as far as impression wise. You don't learn how to take them in college. At least I didn't learn how to take them. You obviously have to know how to take them, but there are specific things you need to look out for when you are taking them, such as air bubbles in the impression. Obviously, if you send it off to a lab and it's not quite right, you're going to have to retake them. So if you want to know about that, you can actually do impression courses. I know that they run these in some colleges in London. So a lot of the time you will have to travel if you don't live there to do these courses. You probably won't be able to apply that to practice. Some practices you might be able to. At my practice, we wouldn't do that. The nurse wouldn't take the impression. We would just mix it, possibly load it, and then pass it over to the dentist. But some dental practices may ask the nurse to take the impression if they're qualified to. It's certainly not a qualification that you need to have. It may help if you're changing dental practices to have that qualification. Don't think it would affect pay in any way. I don't think you'd get a pay rise from it. You know, it might be all practice dependent and how your dental practice want to work. Maybe if you do take the course and they do ask you to take impressions, you might get a pay rise from it, but that's definitely one extra qualification that you can have as a dental nurse if you would like it. The second qualification you can actually get a little bit of use out of if you want to take it, and that is to do a radiograph qualification. A friend of mine at my old practice went ahead and did this, and she now does the auditing for radiographs in her practice. She will also, from time to time, take an OPG x-ray, and that's basically a huge one that goes around the head and does the entire mouth. I'll put a picture in. This is actually my OPG, so these are my teeth. That's something that she can do, and that's not really positioning anything too much. That's more just working the machine. But she went ahead and did a radiograph course. The radiograph course that you take as a dental nurse, you will have to sit an exam for. Oh hell no! Because it's not just learning about the stuff. You obviously learn about it in college. You have to learn what to do, how to process an x-ray, but when you actually do a separate course on radiography, then you will learn how to actually take an x-ray, how to read the x-rays properly. I certainly don't want to take a radiography course because I'm not that good at it anyway. As a dental nurse, I cannot diagnose a patient from an x-ray. I can't really give any information. If there is a hole in somebody's tooth, I can see that on an x-ray. I will know that that's there. I will know they need a filling. I can read things like that. But as far as actually diagnosing, you're not allowed to do that as a dental nurse. I don't actually think you can do it if you have the radiograph qualification. You will obviously be a lot better at reading them than just a normal dental nurse, but you can't say to a patient, oh yeah, you need a filling in your upper right 3 distally. So going back to the course now, my friend does do the radiograph audits for her practice. What this course will also allow you to do is be qualified to take the x-ray. Generally the dentist is going to do them, so you probably won't ever have to do an x-ray. So again, that's another course you can take if you just want to stick with the dental nursing. So now I'm going to move on to a couple of different routes that you can take, and the first one is one that I haven't taken as a route, but I've done in practice, so I know a little bit more about it than the last one, and this is orthodontic nursing. In my old practice, we did NHS orthodontics, so children that qualified to have braces for free on the NHS. My current practice now only does braces for private reasons, so people that either wouldn't qualify on the NHS, or if they've just got a bit of overcrowding that they want sorted and they would come in. Now for me personally, I love doing ortho nursing. I think it's really enjoyable. I love being practical with it, and as an ortho nurse you are kind of constantly doing something. If you're just doing general dental nursing and you've got a day of checkups, you are just sat at the computer typing and then obviously wiping down surgery afterwards. But as an ortho nurse you always get to do something. You get to see results every time you have the same patient coming in. You get to see the progress that they're making, and it's really cool to see what some metal and some tiny rubber bands can actually do for somebody's smile. So yeah, I really enjoy the orthodontic nursing. If you would like to take this as a route, you can actually go to an orthodontic specific practice. You can become a nurse just for orthodontics. Orthodontic nursing, there is obviously things that you don't do as a general dental nurse. It's definitely a path that I would consider taking if I was going to stick to be a dental nurse for a long time. Now there was a day that I was doing study models all day. Well, the morning, I was only working the morning. So I was mixing alginate from 8 in the morning until 1 in the afternoon. I was like this just all morning because we had like 10 minutes per patient. It doesn't take very long to do an impression. I quite like doing stuff like that. I love mixing alginate. I don't know why, I just find it a bit fun. I love orthodontic nursing, and I think it's definitely a route to consider going down if you don't want to be doing checkups and fillings and root canals and crowns and stuff like that. I think that's a really good way to always be practical. So the very last thing I'm going to talk about today in this video is going to be a theatre nurse. I've personally never done this, so when I'm explaining this, I'm actually going off of a friend of mine who has done it. She went into a hospital and was doing dental nursing in that environment. From the stuff that she's told me, there is a lot of stuff which is very different to general dental nursing. I will just give you one example of something that she's told me. In general dental nursing, obviously if you need to change your gloves, you would take them off and you would change them. You know, if you need to go into a cupboard, then you take your glove off, you go into that cupboard, get what you need, put a new, fresh, clean glove on. Bob's your uncle. In the hospital and theatre environment, if you need to go into a cupboard, you cannot put a glove back on until you have surgically scrubbed your hands again. I'm not entirely sure why, but she's told me that everything has got to be out. Obviously all wrapped and covered up because you don't want, you know, the airborne stuff. But if she'd forgotten something, it would be a nightmare because she can't just go, oh, take her glove off, go into the cupboard, get something out, put a new one on. She'd have to take both gloves off, get out of the cupboard, surgically scrub her hands up to her elbows, then put a new pair of gloves on. She's also said things like, okay, sutures, you couldn't get them out of the pack, obviously with gloves on, and pass them to the dentist. You'd have to open it and drop it onto the tray. Regardless of the fact that the gloves are clean, you can't touch something clean. That, like I've said, is not my personal experience. That is a story that I have been told from a friend of mine that does work in a hospital in that theatre environment. This is another route to consider if you want to do something like that. Obviously, there are things like surgical extractions. So as a theatre nurse, you would be assisting in that hospital environment with surgical extractions. Basically, anything a patient requires surgery for, you could be the nurse assisting with that surgery. In the mouth, obviously, I'm not talking about ankle surgery. If that is something that you would be interested in, that's definitely a route to think about going down. I personally am a bit too squeamish to do anything like that. I would hate it. Because this isn't something I've personally done, I don't know too much about it. I can just go off research that I've done and stuff that people have told me because they have experience in it. Anyway, that pretty much brings me to the end of this video now. I really hope you guys enjoyed this video today. If you have any questions, pop them in the comment box below. If you have any stories you'd like me to tell, pop them in the comment box below. So if you liked it, please don't forget to give it a thumbs up, click that subscribe button down below, and I will see you in my next video. Bye!